Guys, welcome back to my channel. So I'm going to talk about today patient health questionnaire. Okay, because some students find it very difficult, and it seems difficult also because there are a lot of questions which you need to ask. But basically you just need to ask the questions about the one they have selected, three. Okay, because you will not be having too much time in the exam. Remember, you have only 12 minutes for the assessment station, so you're going to ask the questions about only the one they have selected, number 3. Okay, so I will be sharing the picture of the PHQ9 just to make it easy for you guys. Okay, so after doing the observations like blood pressure, pulse, temperature and respiration, there is no SpO2, there is no saturation level in this station in the community setting. Okay, so because you just need it for the news chart but not for the community setting. PHQ9 depression patient you will get in the community setting. Okay, so you are not going to check for the saturation level. After doing the observations, you can ask the patient. Okay, so as I can see, you have completed your patient health questionnaire here, and would that be okay if I ask you some questions about that? And then with the patient concerned, you can go ahead. So over the past 2 weeks, how often you've been bothered by any of the following problems? Okay, so I'll be asking you one by one. Is that fine? Okay, and then you have ticked that you're having trouble falling asleep or sleeping too much. You have ticked 3 for that, means nearly every day you are having this feelings. And could you please confirm it for me? Are you having trouble falling asleep or you're sleeping too much? So patient will say if they are having trouble falling asleep or they are sleeping too much. And then they may have ticked for number 3, poor appetite or overeating. So you can ask the patient. So you have also ticked number 3, you are feeling, oh sorry, so nearly every day you are having poor appetite or overeating. Could you please confirm it for me? Are you overeating or you having poor appetite? So patient will tell you what they are feeling, what problem they are having. Okay, then you can say, if they have ticked number 3 for that, trouble concentrating on things, you can say that you have also you are also having trouble concentrating on things such as reading newspaper or watching television nearly every day. Is that correct? Yeah, you just need to confirm, you just need to be interactive with the patient, and just ask the question, confirm it with them. All right, and then at the end you can tell the patient, okay, just give me 2 minutes, I'm going to calculate the PHQ9 score, and whatever reading you get here, you can add the total score together. Okay, and then at the back of the PHQ9 you will see the score and then their diagnosis and recommended treatment. So I'll be putting a picture for that also for you to make it easy. So for 5 to 9 score is the minimal symptoms of depression. Treatment recommendation is like a sport, educate to call if worse, or return in 1 month. In the community setting, if they have got a score of 10 to 14, you can tell them that the provisional diagnosis for 10 to 14 score is minor depression, dysthymia and major depression, and we'll be providing you support throughout the procedure. And then we are going to refer you to the psychotherapist who may prescribe you antidepressants. Okay, and then if their score is 15 to 19, you can tell them the provisional diagnosis for your PHQ9 score is major depression or moderately or severe depression. Okay, and for that we are going to refer you to the psychotherapist and they are going to give you antidepressants. Okay, so it will be there on the back side of the exam paper, PHQ9 paper. Okay, so you just need to explain it to the patient. Okay, and if they have got a score of more than 20, you can tell them that your diagnosis is major depression, and then again psychotherapist referral and antidepressants. Okay, and PHQ9, it can be quite confusing. Okay, so make sure you clear your mind and prepare and practice it, okay, with your friends or colleagues. Practice it every day before the exam. All right, and then you can do it. Yeah, good luck for your exam if you're preparing for the exam. And then share this video with your friends and colleagues who are preparing for their exams as well. And please don't forget to subscribe, like, and share my video with your friends and colleagues. Thank you so much. Take care.